Welcome to the next human. My name's Arav, and I'm here with Rebecca Fernandez, a clinical research coordinator with UCSF. Thank you so much for being here today, Rebecca, and
Having me.
great to have you on.
Thank you for having me.
Great. So yeah, with that said, let's just get started. Like, why don't you just kind of walk me through kind of your life's journey? Like what steps did you take, and how did those steps get you to where you are today?
Yeah, so I grew up in North Bay, in Sonoma County. It's a small town called Rohnert Park. I grew up there all through high school, and then I did my undergrad at UC Davis. I started at Davis as an animal science major. I took a few classes in that major, and then I decided I didn't want to do the vet route. I love animals, but it wasn't for me. So I switched my major to global disease biology, and that's what my degree is in. And now I'm working at UCSF. It's my first job right out of college, and I'm working on a clinical trial.
Awesome. And so I guess you mentioned you like switch tracks in college and just kind of like I guess what was your interest in like vet school first, and then I guess like what made you like switch?
Yeah, I really love animals, but I took a few classes that had labs where we had to interact with farm animals like horses, sheep, and it's very hands-on. And I decided it wasn't for me, but I'd still like environmental stuff and animals. So I learned about the One Health idea, which is what we do in global disease biology. So we kind of study how disease affects animals, the environment, and humans. As you know, you can get a disease from an animal. You can get different viruses in your food, in the water, in agriculture. So I kind of liked the idea of all three things and how they interact with each other. So I decided to make the switch.
And I mean, I guess that field, especially now, like in the, like the sort of post-COVID world, like or post-pandemic at least, like um,
Mhm.
that field itself is like just pretty buzzing, I guess, right?
Yeah, exactly. I switched my major in January 2020, and then the pandemic hit right then. So it was kind of a good time for it because then all my classes were about things that we're all living through. So it was really interesting to learn about it from different perspectives.
Yeah, totally. And I guess so yeah, just more on I guess like what you're doing right now as the you said clinical research coordinator. So I guess like what do you do as a research coordinator?
Yeah, I'm working on a clinical trial for UCSF. So I'm in the Department of Medicine in the Division of Infectious Diseases. So my principal investigator, her name's Dr. Susan Wong. She's based in UC Irvine, but she's doing a trial right now to decrease surgical site infections. So a lot of people, they have surgery, and when they go home, they're not really taught how to keep themselves clean. You're supposed to shower a lot, but they don't know that. So sometimes they get infections in the incision where they just had surgery. And what happens is they're readmitted to the hospital, which is really bad. And they're put on antibiotics. So the purpose of her trial is to give patients an antiseptic soap to use for 30 days when they leave the hospital. And it's just to make sure that they keep themselves clean and that they're cleaning the bacteria off their body. And then hopefully they don't develop any infections after their surgery.
So is the focus of the trial the soap, or like do you think if the soap works?
So yeah, so there's a placebo and then there's also an antiseptic soap. So if you were to go into surgery for an abdominal surgery, they would tell you to use a specific soap the day before your surgery, just because they want to make sure you cleaned off any bacteria before they cut you open. But after surgery, they don't give you any type of soap, but it's just as important afterwards to make sure you're healing right. So basically, the point of the trial is they want to show that post-op care is just as important as pre-op care for surgery. And they want to make it a standard part of care so that every patient is given soap when they leave the hospital.
Got it. And I guess it's also like on the patients themselves. I mean, I think I like heard before that like doctors only like I forgot what it is, but like they like can only like treat the patient, but like the patient like themselves are the ones who like treat the disease. or something like that.
Yeah, I would say that's so right. Doctors can only give so much advice, but once the patient goes home, it's really up to them. Like some people don't shower as often, they don't change their bed sheets, their towels. So there's so many other ways you can get an infection. So it's really up to patients sometimes to, take charge and take care of themselves.
Mhm. And yeah, I mean, like I mentioned before, this is kind of like public health is pretty much like the um or at least like one of the biggest concerns in like the country. And yeah, I mean, yeah, you're also like I guess on the wave. So I mean, like, how's that been? Like, have you mentioned like is able to like study I guess like what's happening in real time in your classes and stuff, and like how just could you like give me an example of that and stuff?
Yeah, I would say all of my classes, as I got into my junior and senior year of college, were about the pandemic and about coronavirus.
Mhm.
A lot of my classes were about things like virology, like how the virus actually attaches, the microbiology side of it. So I got to learn, how the virus is actually getting inside of our bodies.
Mhm.
But then I also got to learn about like policy. So how do we make laws for, like masking or different interventions to prevent the spread of disease? And then I also did like epidemiology classes where we model how disease spreads, and you can see like a mathematical model of it. So it was interesting to see it from different points of view because obviously we saw it in so many things like with the vaccine and masks, and no one could go to work or school, so there's a lot of parts to it, so it was really nice to learn about that.
Mhm. And I mean, like with the subject like disease, I feel like it's really hard to identify like an end goal, um,
Mhm.
because a cure just kind of is in some cases is just like not possible or really like hard to achieve. And I guess just like my question would be like, what's kind of the order, what's like this milestone, like what's kind of the um yeah, like what's that like trajectory of like um eventually reaching a cure.
Mhm. I think especially with coronavirus, we saw like a lot of people didn't know what was happening, even scientists, like we took it day by day as we learned more information. So I think it's kind of difficult to say with newer diseases. But I think for most diseases, you want to find a cure, like a medicine that can cure it, but also like a vaccine, a way to prevent it,
Mhm.
or some sort of way to stop people from spreading it more. I think that's the main part. And then I think teaching people is also really important. Education's a big part of it. I
Mhm.
think like for the vaccine, like a lot of people, if you're not don't have a STEM background, you might not understand how it works. So I think it's important to, explain to the general public the way things are working.
Yeah. Yeah, I think we've all been able to see like the impact that like um clarity can have on just like a population, and just kind of um if we can get everyone on the same page, how much bigger of an impact like treatment would have. And
Mhm.
definitely, and I think like on this subject, like there's a lot of like chatter out there, and I think people are like kind of like expecting like um I guess sort of like a rise in, or not, maybe not rise is the right word, but just kind of um bio warfare, just kind of like the potential, like I guess like the future potential for disease is like like what we can do so much more now. And I guess the question is like, are we prepared? And I guess like what kind of like public health measures do we have in place to like defend?
Mhm. I think, yeah, it is really scary, the types of diseases that are out there. And, we can't really see them coming. It's hard to predict. Um, I think there's only so much we can do just because, each individual person is different. Something I found, at least with public health, is especially with prevention, it's harder to convince people sometimes to like wear a mask or get a vaccine, or like with my job to use the soap, because it's not something they can see. Like once you're sick, you can understand like, oh, I want to get better, I need this thing. But the idea of preventing something before it happens is sometimes harder to explain to people, or they don't see it as something that's as important because it's not affecting them at that time directly. So I
Mhm.
think that's also a big problem with it.
Yeah, so it's kind of like like I'm fine now. If something becomes an issue, then maybe I'll do this. But like,
Mhm.
yeah. But I mean, would you say prevention is equally as important as treatment?
Yeah, I would say so. I think if you can prevent something from spreading, it would make it so much easier. Obviously, like there's a point where everyone can get immunity, but there's cases where people are dying, and that's not something that we want. Or like I might not be immunocompromised, but I might give it to someone who is, and so it's really difficult.
Mhm. And I mean, this is just kind of like a more personal question, but it's just like maybe there's something like you were studying or just came across and just you just thought like it was really cool. Or just like I guess like what kind of interests you most? Like what kind of like you saw something and you like really caught your attention about like the field.
About the field. I would say a lot of my classes at Davis taught me some really interesting things.
Mhm.
I took like a global health class, and it was with one of my favorite professors. And there's like other countries where they don't have access to great health care, but there's a lot of preventative measures you can teach people. So like I remember one really cool thing I learned is she told us like if a mother has a baby, and the baby's sick and like they have like a runny nose, like the baby, you can use breast milk because it's so strong, and you can put it inside of their nose and it helps kill bacteria that's living in their nose. And
Wow.
I always thought like there's so many smaller preventative measures that we don't know about that we can use in other places. So I always thought that was really cool. And I think it's like really cool all the research that's going on, even at UCSF, at UC Davis, at a lot of the bigger universities that they're doing on different viruses and infectious diseases.
Hmm. And you brought up a good point about um, like different countries and stuff and how um different countries have different like health infrastructure, access to medical supplies, and just kind of how we talk about global health, and it's a term people throw around a lot, and I think pretty pretty fairly and pretty lightly. And I think um like I guess how do we manage like global health versus national health or something? Because I think um nations, like countries, each have like obligations to their citizens, but also like humanitarian like obligations to like the world, and just kind of how I don't know, like I guess like how do you think like we balance that?
Yeah, I think it's really hard with other countries. Like, obviously, there's bigger organizations like UNICEF or the World Health Organization that helps in other countries. I think sometimes it's difficult because they might feel like we're sending people in to help them. It's kind of like this savior complex. But I think a bigger part of teaching public health to different countries is involving leaders or people that are important in those countries in those decisions. I think it's much easier to teach people when you have someone that they can relate to, versus like if me as an American going into another country and trying to change things around. I think you can still teach people, but I think it's important to use the people that they have and teach them so then they can go into their communities and help people.
Mhm. um yeah, and I think yeah, no, I mean definitely I think there's certain kind of like a had to balance like just kind of like the yeah, savior complex, I guess is a good way to put it. And yeah, I mean I guess this is a little also a personal question, um yeah, but you, like, I mean, what are your um future plans, I guess? Like what are you yeah, I mean in the field.
Yeah, I'm thinking of doing a master's in public health. That's kind of like the area I'm really interested in. And I'm not sure like what area specifically. I really like maternal and child health. I think that's really interesting. And working in infectious disease has been super interesting too. So there's like a lot of research there. So I'm still kind of feeling out which route I want to go down, but probably, yeah, more schooling and focusing on public health.
Awesome. Yeah. Well, sounds like a good plan. And yeah, I mean, so we're about done here. So I'll just, throw out my last question. So, what's like one piece of advice you'd give to high schoolers who are looking to, or just curious about, I guess, just public health in general and just, yeah,
Yeah, I would say explore like different sides of the STEM field. Public health has a lot of different areas. Like there's environmental health, there's policy, like public policy, there's epidemiology, biostats, community health. So there's a lot of different parts if you have different interests. So I would just say explore more. And there's so many jobs out there that you might not know about. Like I didn't even know my job existed when I was in high school. So yeah, I would say just explore and talk to different people and just see what interests you.
awesome. Thank you. Well, thank you for the advice. And
Thank you.
thank you also for being on the podcast. It was lovely to have you on.
Of course. Thank you for having me.